this is what it is and how we're going to move forward, but no one is talking about how we're going to manage through all of this. And so, I have on the line Audrey Davis, who is a licensed professional counselor and proud woman of color. Audrey, are you there?
I'm here. Hello.
How are you?
I am so well in the midst of all this. I'm adjusting as one could to new things. I'm really happy to be on today. Thank you for having me.
Oh, no, listen, I need you. I need all the counselors I can find, everybody that I need to. Tanya Lapido is going to become a regular for me. She's dealing with some stuff too. But, I when I heard from my producer that you wanted to come and talk, I was like, this is perfect because grief is now starting to take hold. Right? And no one is talking about grief, Audrey, and grief in the sense that I know people now whose family members have died can't have a funeral, don't know when the body's going to be released, don't know when they're going to have a death certificate, don't know any of these things. And how do they manage in the middle of all of this and try to behave as if life is going on as normal in anything that is normalcy?
Yeah, great question. I also want to mention I'm also a public health program analyst with the City of Philadelphia's Department of Behavioral Health and Social Disability Services, DBHIDS. And so,
public health analyst?
I'm sorry?
Did you say you're a public health analyst?
I am a public health analyst as well, yes. So I'm glad that you mentioned grief because we can talk about this in both lenses, from a counselor's perspective and also with the public health lens as well. Grief and loss, normally we think about that in terms of the Kubler-Ross model, right? Used to be 5 stages, now there are 7. Some people have added in shock and testing as well. You mentioned I call it grief with a capital G, right? When you lose a loved one. In the midst of this crisis, we are hearing more and more stories of people who are unfortunately passing away. We also know statistically, right, more and more of those folks, the majority, at least in Philadelphia and other major cities, upwards of 50 to 70% are African American. And so this is hitting our communities very deeply, as you said so eloquently, in the plexus. But in addition to grief with a capital G, I think it's important that we frame this conversation grief with a lowercase g, right? We're dealing with feelings of loss. We've lost our everyday normalcy. What we used to do, it's kind of gone out the window. I'm used to getting up, getting ready for work, hopping in the car, going into the office, but unfortunately, we can't do that right now. And so there's a sense of loss associated with that as well. In moving through the stages, I think it's first important to recognize that our feelings are valid. Whatever we're feeling right now, whether it is shock at what is still going on or maybe even denial. You had a caller on earlier talking about some of the conspiracy theories that are arising and how people aren't taking it seriously. And I think from a counselor's view, I look at that as denial. People aren't really ready to accept the loss of what was normal to them, or they're not ready to accept the loss of maybe a loved one or a significant other, and so they're coming up with other theories that help them better rationalize it. We also, I think, want to be aware of anger, right? A lot of people are angry right now, and I think rightfully so. There's not much within our locus of control. There's not much that we can change at this moment. We don't have a lot of answers. We're still learning new information, working very, very hard to support our communities. But anger, I think, is valid and something that you want to make sure that if you are experiencing, you allow yourself to feel.
So, Audrey, let me stop you there for a second. Let's stick with anger for a minute. How is that presenting itself? Because I think when people see anger, they think someone throwing things or having a fit. It could be withdrawal, right? It could be. So explain to people what that looks like so that folks have an idea of, I woke up at 1 o'clock the other morning, Audrey. There was a man walking down the middle of the street, screaming at the top of his lungs and crying, right? And I could just feel his grief and his anger, and I couldn't really tell what he was talking about, but I identified immediately with him, even though I wasn't doing what he was doing. I felt it, but in a quieter way. So can you describe to people what we should be looking out for, and so that we can identify it for what it is?
Certainly. Right. So you mentioned initially kind of the more overt, aggressive types of anger, right? Someone who's maybe throwing objects, screaming, just physically showing with their bodies what they're feeling internally in a way that is very overt and overpronounced. But then there's also that anger that often is internalized. I think Freud, although I don't agree with all of his theories, Freud put it really well when he said that depression is anger turned inward. And so if you just let that sit with you for a second, a lot of people are angry, and that anger is actually manifesting as more depressive symptoms. You're seeing more of the sadness, the tears that you mentioned, the isolative behaviors, that kind of just withdrawing from people. The problem, I think, with today's current state is because we have been ordered to stay at home, we've been ordered, in a sense, to isolate. It exacerbates, some of those feelings of anger and feelings of loneliness. And so it slides very quickly from this internal kind of quiet brewing to now a full-blown depression. With depression, I think it's important for listeners to understand, there's different types of depression. I think something that may be manifesting now more is what we call situational depression. It's brought on by a very specific trigger, a very specific situation, i.e. job loss or the loss of a relationship. In this case, it's the pandemic. And so anger is slowly or maybe quickly, depending on the person, being translated into depressive symptoms. And with that, I do want to take a moment, if we have time, just to do a little bit of backtracking.
We have time. Go ahead.
Community. Okay, wonderful. Just a reminder for us in the community, we know about the Tuskegee experiment. Some people call it the Tuskegee study, right? Back in 1932, they started to work with a group of Black males at the Tuskegee Institute. Some of them had syphilis, some of them didn't, right? For over 40 years, they didn't get the proper treatment, even though there was a cure, even though we knew penicillin could cure it by the 1940s. And so with that knowledge, we have a distrust for not only medicine and the medical model, but I think sometimes we have a distrust for information, and we learn to rely on our own remedies. Some of us use ginger ale, some of us use Robitussin, right? We learn to rely on our own remedies to cure physical ailments, but when it comes to behavioral wellness and mental wellness and strength, we're not always quick to acknowledge what we're feeling. If we're feeling angry, if we're feeling isolated, if we're feeling lonely or scared or anxious even, that's not something that we always encourage discussing within the community. Although I will say we've come a long way. I know some amazing therapists of color, but I think that that's something that we also want to be mindful of at this time as well.
Right. So, Audrey, as you spoke about this, it brought up some stuff for me. Oftentimes when we want to feel, we're told not to by the messaging that we get from others, right? Why are you talking about that? Why do you want people to know all your business? Why are you doing X, Y, and Z? It's almost like we always have to stay in this confined space of not feeling, not doing, not thinking, not, to the detriment of our own bodies and souls. And so having you on today to discuss this is incredibly helpful in that it helps us to delineate and start to search through what are the things that we have just been kind of pushing off to the side. People are drinking more. People are, really concerned about not having hugs and not having that human touch that they've always wanted to have. People are concerned that folks that they wouldn't speak to because for whatever the reason they thought was important at the time, those folks have now died and are dying. And there's this level of grief, capital G, that they can't deal with because they didn't deal with grief, lower G.
Amen.
Right? So, I it's so funny because now they're really going to realize on WURD that I'm smarter than the average bear. I try to really identify with my listening audience as much as possible so we can understand where we're coming from. But we have to, as a people, be okay with talking about the things that are showing up for us every single day, showing up in the way we are treated, showing up in the way we are not treated, And showing up as a people, oftentimes some of us are introverts, but a lot of us are, we're expressive in that we like to hug folks, and we're not able to do that, right?
Yeah, it's a hard piece. It's hard to stop hugging people. It really is. Like you find yourself almost kind of physically lurching, and then being like, no, this is not. I can't do this because I love you, and this is the way that I'm now showing love. It's a very removed state. So yes, I completely what you said resonates with me, and I think a lot of your listeners. The great news is that at CBHIDS, we have a website. It's called healthymindphilly.org, Again, that's healthymindphilly.org. You can go to the menu. There are a plethora of resources available. You had a caller earlier talk about domestic violence resources, shelters, phone numbers. We have a domestic violence tab. We have a homelessness tab. We have so much information available. You can access it from your phone, computer. If you find that you are dealing with feelings of depression or just sadness or loneliness, we have a 24/7, not only suicide line, but crisis prevention line as well. We have people who are trained in behavioral health and wellness to be able to talk you through some of those feelings that you might be having. In addition, there are other phone numbers, different organizations that you can contact and get involved with. Even though we are socially distancing, I like to say that now we're not working behind the scenes, we're working behind the screens, right? And so we have virtual support groups. I'm so proud of how many providers we have within our network who have really risen to the occasion and made sure that supports are still available, whether they be via the phone or via the computer. You can join pretty much any support group that you can think of, whether it's more traditional for substance use or because you're now at home with your kids and realizing that the teachers weren't lying and that maybe your kids have some behavioral health challenges that need to be addressed. We have a support group for families that you can tune into via Zoom so that you recognize that even though you're physically alone right now, maybe you're physically socially distanced, you're not alone in your challenges as a parent.
You are just chock full of good information in these coronavirus streets. I love it. I love it. So now give me some tips of how people can use their assertiveness to access the medical services at this time. Because, Dr. Ayla was on and she said, unless you are sick, sick to the point where you can't breathe because the hospital emergency rooms are now inundated with coronavirus patients. How can people access the medical services that they may need? You may not have coronavirus, but you may have maybe suffering from anxiety in a way that is debilitating that requires help and support. How can they be assertive to get that kind of support that they may need?
That's a great question. So granted, maybe, again, as was mentioned, the symptoms are not unmanageable, right? If you're having physical health symptoms that are concerning, many insurance providers offer telemedicine at this time. Many employers are also offering the telemedicine option. So you would want to check in with your human resources office or with your insurance company about checking in with a physical health doctor, a medical doctor via phone or online if you're having some symptoms that, again, aren't unmanageable but are still concerning, and under normal circumstances, you might go in and see someone. Now, if it's, as you mentioned, debilitating anxiety or feelings of sadness or depression or things that are just affecting your day-to-day functioning, that's something where you have a few options. If you have an employer that offers an employee assistance program, you can still utilize your EAP benefits. Again, you want to call your human resources office or your insurance company to access EAP. If you do not have those benefits available, again, healthymindphilly.org. You want to go there, click on the menu, go to the resources tab. You can also, even if it's not a crisis, call and get information about different providers in your area. The great thing about this right now for licensed professional counselors such as myself and other therapists, people in behavioral health, is that no one's office is physically open, so we have lots of time and availability via telehealth. I actually find with some of my previous clients who've had a lot of trauma, they prefer that sense of removal. With telehealth, it feels as though while they're becoming more comfortable and building rapport and sharing some of their story, they're not as exposed. And so I think actually people, it sounds kind of sterile, but people sometimes prefer the telehealth option.
Right.
So what better time to try than now? We have more time. There's definitely more availability for professionals on their schedules. You can find all that information on healthymindphilly.org as well.
One more question, and then I promise to stop torturing you with all of this, because this is a lot, and I want my people to really hear. There are children who are now experiencing the death of family members, fathers, mothers, grandparents, and they're trying to cope the best way they know how to, but they're home from school. Usually school is a place where they can go to hang out with their friends or be around other people, but they're now stuck within the walls of silence as they're dealing with these deaths. What tips would you have for them and their family members to manage as they're going through this?
Excellent question. So depending on the age range of the child or adolescent, for younger children who maybe just lost a grandmom, granddad, they may not have the vocabulary to talk about their feelings like we would, right? They don't know what sadness would be described as, but if you pull out your phone or your computer or just kind of Google image an emoji chart or an emotion smiley chart, you can show that to them and ask them, hey, which one is you right now? Which one are you feeling? Tell me more about that. What is it that's going on for you? It's really important to use open-ended questions regardless of the age level, even with adults. So what you'll want to do is ask questions that don't automatically require a yes or no answer. Instead of asking, are you sad? You say, how are you feeling? Point to that feelings chart. Ask them to tell you more. You can also really, for children and teenagers too, you want to normalize their feelings. It may not feel normal to them. This may be the first loss, this major loss that they've had, but you want to let them know, hey, I'm feeling sad too. This is normal. Like it's the new normal, but it's normal, and I'm right there with you. And you can make that a conversation. Help them to see that even though mommy's strong or daddy's strong or auntie is strong, auntie has feelings too. And part of being strong is being emotionally intelligent enough to acknowledge when you're having some challenging feelings. In addition to that, you want to make sure that you do keep some kind of routine going with the kids. I know that routine is a big hot button word right now because our routines have been thrown out the window, but it's important to have a family meeting of some sort. Talk about what the new routine is going to look like. You can even use your family's last name. You could use the Davis family protocol for COVID. Make it an activity for them, but it fills in with those activities ways that they can process their grief. You want physical activities. Lots of children and adolescents respond really well to art. When I was an inpatient therapist, I did a rap hip-hop group with my adolescents that they absolutely loved. Yes, we would just go around. Each person would come up with a few bars, as kids call it, a few lines of their own rap to describe how we're feeling. And then we'd have someone do a beatbox and just go around and share how we're feeling, and then afterwards process it as a group. Yeah. That's something that you can do with your kids. They're going to look at you like you're corny. They're going to say that you're an old head. It's totally okay. Take it all with a grain of salt. I promise it actually works and gets them talking. And again, for additional resources, you know the website by now, healthymindsphilly.org.
Minds.org. That's right. And you have a 24/7 crisis line, correct?
We do, and we have tabs for children and adolescents as well.
Oh, Audrey, thank you so much. With the minute that we have left, is there anything else that you'd like to add? Thank you for reaching out to us, by the way. I'm grateful to you that you're thinking this through and made sure that you reached out, because I would not have been able to find you if you didn't reach out to us. So thank you for that. Is there anything else you'd like to add in this last minute that we have?
At this time online, if you just Google free grief resources, free grief and loss workbooks, even if you might not have access to a printer, a lot of the activities you can at least look up online and then go ahead and do them with your child or with your teen or as a family in a notebook or on construction paper. So that's something else that you can also use as well.
Oh, wow. I didn't even think about that. So free grief resources and grief and loss workbooks online.
Yep. Just Google it and there should have lots of stuff come up.
So, Audrey, when this coronavirus thing ends and we're all back into the studios, I'd like you to come in so I can meet you. You are a plethora of great information, and I hope that you continue to stay safe as we move about our day.
Wonderful. Thank you so much. I appreciate it. I look forward to meeting you soon.
All right. So take care. You are listening to The Source, 96.1 FM, 900 AM, 215-634-8065. Streaming live on WURDradio.com. Follow us on